The topic of discussion is patent ductus arteriosus. From title it is clear that ductus arteriosus, which is functioning before the birth, is being patent, right? It is not being closed, it is being patent. That's all. Okay, in this schematic diagram we can see what is this atrium, right? And the below one, these are our ventricles. Now here what is going on in the case of patent ductus arteriosus is that the ductus arteriosus, which is functioning before birth, what is the function of this ductus arteriosus? It helps to carry what the blood from what left ventricle into what into our these pulmonary branches or directly into pulmonary branches. That means it helps in connection between what is this? This is our descending aorta. It helps in connection between aorta to our what pulmonary artery. So that is the function of ductus arteriosus. But as child what get birth, at the time these ductus arteriosus, it need to be what? It need to be what? Degenerated. It need to be not functioning, right? But here what is going on? The blood is what? After the birth also, the individual is what? It is having this ductus arteriosus in patent condition. So the oxygenated blood which is reaching into left ventricle, it is what? It is supposed to go only to what? Our this descending aorta, but it is somehow going into what? Our this pulmonary, the branch of pulmonary artery also. Now from this branch of pulmonary artery it will go into lungs, and then again it will go into what? Our what? Left atrium, and then to left ventricle. Now here, since there is what connection between this left ventricle to what? To our this region. What is this? This is right ventricle, right? This is called left to right shunt, right? Now left to right shunt, and here the failure, which one is failure right here? Here the left ventricle is only failure, because everybody is doing their one job, right? The left atrium is sending into left ventricle, but left ventricle is not able to send all the way to what? Descending aorta. So the failure, this is also called left ventricular failure. Okay. Now since there is a large accumulation of blood right here, why? Because everything, it is again coming into left ventricle, right? So there is accumulation of large amount of blood into left ventricle. So the blood that is present right here will take extra time, right? It will take extra time to go from this what? Aortic valve. So we know what is second heart sound. Second heart sound is A2P2, right? Aortic what? Valve, closure of aortic valve, right? Closure of aortic valve to closure of pulmonary valve. Now the normal what? Physiological what? Time between these two is 30 milliseconds. Since I am saying that there is a large amount of what? Blood right here, and it will take what? A large amount of time to empty, right? To what? To empty this left ventricle. Then what will happen? This our aortic valve will close. That means there will be delay in closing of this aortic valve. That means aortic valve will shift right here. That means what will happen? There will be narrow shift, right? There will be narrow split of what? S2 sound. Okay, I think we are clear with it. Now moving further, now how these are presented. Okay, in case of preterm children, right? In case of preterm children, these are presented at birth. In the case of term children, these are what? Presented at 6 week, right? At 6 week of birth. And talking about child, what are the characteristics, clinical finding in child? They become breathlessness, right, on breastfeeding, because what? They are not able to what? Breathe properly, right? The oxygenated blood that is supposed to come all the way to descending aorta is not coming completely into descending aorta. It is again what? Going back into what? Our heart. So now, so since the child is what? Not able to breastfeed properly, since he is or she is suffering from breathlessness, infants get irritable, right? Because of poor intake. Now what are the observational, right? Observation that we see yes, narrow split S2. Yes, we have already said there will be a narrow split of S2 sound, because aortic, there will be what? There will be what? Aortic aortic valve, closure of aortic valve shifting toward what? Our pulmonary valve. That's why. And the murmur right here is called continuous or machinery murmur, right? And it is characterized by what? It is characterized in such a way that it is present hard in both what? Systole and disystole. We know if it is S1, it is S2, and it is again S1, then the duration between S1 and S2, it is called systole, right? S1 and S2, it is called systole, and from S2 to S1 again, it is called what? Disystole. So here the peak of this murmur, or the peak of our this continuous or machinery murmur, is observed right here in what? In S2 place. So peak of murmur is in S2 place, and it is hard in both systole and diastole phase, right? And it is called machinery murmur or continuous murmur. And how we are going to identify our this condition? We'll do what? Transthoracic echocardiogram, right? Transthoracic echocardiogram. And talking about treatment, how we are going to treat in the case of preterm children, we are going to what? We are going to provide indomethacin or ibuprofen. It will what? It will help in what? Our prostaglandin synthesis, and this will play a role in what? will play a role in what closing the patent ductus arteriosus. And talking about term child and 1 year old child, what we do is we'll do surgical ligation, right? We just ligate patent ductus arteriosus. Okay, this was about what treatment of patent ductus arteriosus. And yes, since patent ductus arteriosus is a condition of narrow split of S2, similarly earlier we talked about aortic stenosis also. Aortic stenosis is also what? It is the condition in which there we find narrow split of S2, right? And also hypertrophic obstructive cardiomyopathy, soft valvular aortic stenosis. Here also we find what? Narrow split S2. Similarly, left ventricular failure, we said under left ventricular failure we studied what? Patent ductus arteriosus also right now, and it is also called what? Anterior wall myocardial infarction, Coxsackie B myocarditis, right? And similarly wet beriberi in alcoholic condition and severe anemia. So these are the condition in which we find narrow split of S2 sound, right? There is what? There is less than 30 milliseconds gap between our aortic valve closure and pulmonary valve closure. So this was all about what? This was all about our patent ductus arteriosus. I hope we are clear with